I heard a little.
So their project is called Hetero project, and this stands for make a difference. So here we are talking about many cases and well, diseases and lots of diseases, not about real cases. And maybe you can help lots of people or people who lives in their area where few doctors are available for the patients. And we can help and we can learn a little bit. So that's the project. And so the problem is that the staffs in Nepal or any other countries who are not doctors have to see patients and interview with patients. And we are here, just remote area, right? So
remote area.
Yep.
Rural.
So making consulting form, fill out with the consulting form, fill out the consulting form. Fill out the consulting form with patient's information by non-medical professionals is the most important step here. So we devised a form to this, which is called remote examination. We need by personnel without medical training or education, aka Hetero remote. How's that? This is a form of consultation.
You are a magician of language.
Maybe we have to another forms for the answers, but this is just for consultation, which is written by non-medical professionals in local areas. So talking about our goals here. Well, I found that this is not easy task for. So our goal is to, of course, make people in local areas such as Nepal talk to patients and fill out this form. So I wanted to make it difficult to make it. So I found that it cannot be easy. It cannot. Well, if you try to rifle through the papers, it consists of more than 10 pages, and there's no blank space. You miss that. Actually, it's not the papers themselves does not. It's not used for filling out. You have to blank pieces of papers. But it was impossible without this form. But it's difficult, but something difficult is much better than something impossible. So if you think it's too big, just consider that making diagnosis cannot be easy. It would require lots of intelligence. But I try to make it clear as much as possible, even for the people who never had medical background or knowledge. So let's look the form. So if you see here, this form is just for skin problems. So for each symptoms, there's different forms. For example, form number 101 is for stool problems, including diarrhea and constipation and blood stool and so on. There's no form 103 yet.
Did you make all the forms of including all common symptoms?
Just two now.
Just two?
We made these two because they are most common symptoms in Nepal.
We need digestion.
So So here, so its definition, it's possible that people, non-medical people, I think, don't know the definition of skin problems. So we are, there's skin problem equals discoloration or lumps, nodules, inflammation, infection, scale, pustule, and any other unusual skin findings. Does it make sense for you? And after that, there is some identification, patient's name, gender, age, and their identification of reporter, and the reporter is required to ask the patient to describe his or her problem on his own. So what we need is kind of open questions, because yes, no questions doesn't give us much information. So we have to ask, please tell me your problem. And after that, right. So and then we can ask, when did the problem start first? And because in many cases, patients already know what the cause is, and maybe their patients have this kind of false belief. So to confirm that, we have to ask what the patient think is causing his or her problem. Preceding events and the progression, how the problem has changed since it started. And the frequency and duration. And there's diagrams, so we can let the patient to point out where the problem is. Actually, this is made for non-medical professionals, so I think Mitch has to understand this. How do you feel about this? It's a lot.
I think so, because this form is for non-medical people, but even though they are willing to make this form for the patients in Nepal, this form could be quite long.
Yeah, it's quite long, and it will take time. But if it takes too long, you can try to finish the science of the form. But it's later, I guess. If you don't have enough information, we cannot make a decision.
This form contains all the information about the patient, but
not all the information.
Almost
specifically for skin problems. Did you read all the questions?
I'm just scanning.
This form has so many explanations and questions. So
yeah, actually, their form has a lot of explanation. More than half of their questions is explanation.
Maybe after the step alone stuff about.
That's for actually, if you
we can make a compact version.
Yeah, we can make a compact version. Actually, if you see this is comment. This is version with comment. Actually, this form is for studying. So it can be diminished into a smaller one once you're used to this. So you can find that.
So you mean they'd use this one to study and then have a shorter one for actual examination?
Yeah, it's possible. So I think this is kind of minimal information we need to make a decision. It's possible that it would take 1 hour to finish, but I don't think it's a big deal compared to thinking of their situation. Probably cannot see more than 10 patients or 5 patients, not 100 patients, of course. but I want to make a proper decision. If we have to make a decision, so it means that we have to enough information, and there's no information, probably I cannot make any decision. And making 100 wrong decisions is worse than making 5 better decisions. I don't think I can compromise, but it's possibly it's unrealistic. But we can start before we can. We confirm this is really unrealistic.
Yeah, you can try it. I think it'll work. You just need to maybe some training.
Maybe.
With the staff.
So, okay, let's see. And it also includes some interesting ideas such as indirect physical examination. We ask their staff to touching their, for example, skin lesions, asking is level based or is it soft or hard, and photographics, facial photos, and their photographs of their skin lesions showing symmetries, and taking photo of patient's eyes. It's possible that the patients have jaundice or eye problems, and this is for future ideas, video or auscultation recording or interview recording. But I think this is not mandatory, and we understand that video recording could be an expensive option. So that's it.
Did you show this?
Excellent.
Did you show this to them or not yet?
We are sent soon. But well, I want to. So I think most of doctors would understand this, of course, but this is for their non-medical professionals. So I want to know if MIDs have any difficulties understanding any. Just let's try this one section. Okay, just about time. Just assume that I have skin lash, big skin lash. And would you try ask questions about this question too?
When did it start?
Yeah.
When did it first start?
Yeah.
This started about 2 years ago, maybe. This flinching is wrong, isn't it?
Yeah. Yeah, I mean, I'd have to like study this for a while and understand exactly.
2B. What do you think is causing it?
How do I know? I'm not a doctor. You are here to let me know the cause the problem. So that could be an answer.
Maybe we can change that to see a 3D sentences to question.
What?
Ask if not ask if the problem is blah blah blah. Not like that. We can use the question like to be.
Like to be?
I think it's better.
Oh, you think this is better than this? But it's not always possible to make a question that way. So, because sometimes.
Epic.
Is the problem did the problem begin with an user event such as an injury?
So all the questions